Hi guys, my name's Amy. I will be talking to you about pertussis today, about whooping cough. And what I'm going to be focusing on is the etiology of pertussis, and I'll touch on the reservoirs of it as well. Hopefully I'll give you a good introduction to this disease. Let's get going. So first off, there are three main bacterium that cause pertussis or whooping cough. The first one is Bordetella pertussis. This causes the vast majority of pertussis cases, the vast majority of diagnoses. There are two other bacterium, Bordetella parapertussis occasionally causes this, and Bordetella bronchoseptica is rarely the causative bacteria. So those three have to be shown present to confirm a diagnosis of whooping cough. But often the clinical symptoms of whooping cough are really distinctive, and it can be diagnosed without this. But if you do need a for sure diagnosis, you can take a culture, and usually this culture is taken from the nasopharyngeal area to confirm the presence of one of those three bacterium. And I can say from experience, I've actually done this. I'm a nurse and I've actually collected this specimen before, and it's just straight that area directly behind the nose, and you actually go through the nose to collect it. And I can say it's not fun for anybody involved, the gatherer or the patient. But that's how you can get a for sure diagnosis of whooping cough, is with the presence of Bordetella pertussis, Bordetella parapertussis, or bronchoseptica. Bordetella. But for our purposes today, we will be focusing on Bordetella pertussis. And I just wanted to hit on a couple of the big characteristics of this disease, or of this bacterium. And they're actually all things that we've been studying, so it's kind of cool that we really know about these things. So first big thing about it, it's a gram-negative bacterium. So it's going to stay pink or red after gram staining. It's not going to turn that purple. Pertussis, like many bacterium that are gram-negative, is more resistant to treatment because of this characteristic. Another big thing, its general shape. It's usually cocobacillus shape, so just a plump little rod, but not quite spherical. Bordetella pertussis is an aerobic bacterium. It survives best when there is oxygen in the environment. And actually, just with the aerobic, Bordetella pertussis usually, where it starts, where the bacterium stays and like starts growing, is in your respiratory tract, in like the cilia and that lining. And so it's obviously a very aerobic environment, and so that's why it thrives so well there. It's also a capsulated bacterium, and this capsule, so not only is it gram-negative, but it's also encapsulated, and this just adds an extra defense against our immune system, and this definitely ups the pathogenicity of Bordetella pertussis. Makes it a little bit harder to treat. This is definitely not something that just goes away, that your body can fight off. Usually requires treatment, especially in children. So just a little review: gram-negative, cocobacillus shape. It's an aerobic bacteria. It's capsulated. It's non-motile, and you can see at this bottom picture down here, it's usually arranged singly or in small groups when a culture is taken, just like that. And that's a pretty good picture with all the staining of what Bordetella pertussis will look like in a culture stain. Keep going. But what really is causing the symptoms of Bordetella pertussis is the pertussis toxin, and that's what this bacterium produces. It's usually produced in an inactive state, and then the toxin is by the bacterium once it starts growing and multiplying in your your respiratory tract. And this toxin, it disrupts the communication between the surrounding cells. And it's thought, there's a little, not for sure, but it's thought that this toxin is really what's causing that distinctive cough of whooping cough. And this toxin also slows down the initial infection response of your immune system. And last, this is pretty quick. There's only one known natural reservoir of this bacterium, and it's humans. And so lucky us. But that is the basics of the etiology of Bordetella pertussis, the main causative factor of whooping cough. And that's all I have for you today. Thanks, guys.